Dr. Meethi Bhanot. I am a senior consultant obstetrician and gynecologist working at Apollo Hospital, Noida.
About your journey through the 9 months of pregnancy, your antenatal journey, which in the end helps you get your bundle of joy. So let's go through the 9 months. Usually, a patient comes to us during the first 1 week of missing the periods. This is the time we examine you, we take your history, we talk about your last period date, we talk about any major symptoms which you have, your medical history, your family history, any history of any alcohol, smoking, and then we do a general examination for you. After we have done the above, then we advise an antenatal early pregnancy dating scan just to confirm what is the exact time period of your pregnancy. Does it correlate with your period date or there is some discrepancy in that? And we advise you some blood tests which are basically to see the level of your hemoglobin, the sugars, the thyroid, some infections and the thalassemia screening. These are all the routine tests of pregnancy which is done usually in the first or the second visit when you come to us. We also prescribe you some folic acid medications and some medication which helps you combat your morning sickness or vomiting. Usually, the only complaint which the patients in the first 12 weeks of pregnancy have is just nausea, vomiting or slight tiredness or sleepiness, which is normal in most of the pregnancies. Then, at around 12 weeks, that is the end of the first trimester, we do a level 1 screening, which is basically to rule out any genetic syndrome in the baby, any risk of mental retardation, Down syndrome in the baby. So this has 2 tests. One are the bloods and the other is an ultrasound. The correlation of both and collaboration of both categorize your pregnancy as either a low risk or a high risk pregnancy. In case you fall in the low risk, we do the normal routine tests of pregnancy. But in case we do find you in the high risk, then we offer you some confirmatory tests. This is the time we talk about diet to you. We give you some supplements for iron, for calcium, some protein supplements. And then starts the second trimester of pregnancy. The second trimester is the next 3 months of pregnancy, which is usually smooth for most of the patients and they start enjoying their pregnancy. We start giving them some guidance on diet and some exercises basically to stay active in pregnancy. Then comes the next set of tests which is called the level 2 screening. This is basically done by an ultrasound as most of the organs are formed for the baby by 20 weeks. So this is the time we get an ultrasound level 2 done to rule out any abnormality or any malformations of the baby, and in case picked up, we can take some necessary actions. We again check your sugars, we again check your hemoglobin at this time. You're also given the first shot of tetanus injection. Then as you advance, depending upon your levels and the growth of the baby, further tests are offered to you. During this second trimester, you're given a flu shot and the last vaccination dose, which is the booster dose. Our third scan comes at around 28 weeks, in which along with the growth of the baby, we also check the blood flows of the baby. From now on, we ask you to keep a track of the baby movements. We ask you to increase the proteins in your diet and also your activity level. We also advise you to keep a track of the baby movements as now these things are taken into account. Your visits are now every 2 weekly till around 36 weeks. 36 weeks again we offer you another scan, and then from then onwards we teach you some exercises which help you plan your labor and help you deliver vaginally. Then your visits are every weekly till the time you come in labor or you are advised to get admitted. At any point of time, in case we find any problems or any complications during examination, like either your sugars increase or your blood pressure is not normal or there are some problems in your routine tests like urine or liver function tests, necessary actions are taken and you may be advised induction of labor. That means we call you and we induce artificial pains or certain other things which could be offered to you. That's all. At the end of 9 months, we wish you have a healthy mother and a healthy baby. Namaste.